The Overseas Pakistanis Global Foundation has today donated a full-fledged ambulance to CoRSU Hospital, a private local NGO with a mandate to prevent disability and restore ability for children through the provision of quality orthopedic, plastic surgery, assistive devices, therapy, and community-based rehabilitation. According to UNICEF, children and youth living with disabilities were pointed out as one of the most excluded and marginalized groups in the world. Most of the disabilities were attributed to limited access to health care, hazardous living conditions, and malnutrition. His Excellency Hassan Wazir Muhammad, the Pakistan ambassador to Uganda, thanked OPGF for supporting the community from where they live and work.
Of the hospital that they have invited me for this important inauguration of handing over the key of the ambulance from the Pakistani community to the hospital. I thank the Pakistani community for doing this philanthropic work. This is the need of the hour. I think they have of Pakistan and Uganda. So I hope that more people will come forward and participate in the noble cause for the amelioration of the people. This is important because the ambulance is very much needed by the hospital. Doctor has just told me that they have been waiting for this good day. So I think this is a gift for the needy people, and I hope it will go a long way with the amelioration and for the betterment of the people.
David Nagy, the outgoing Chief Executive Officer at CoRSU Hospital, also thanked OPGF for the kind donation to the hospital, which they much wanted.
Well, this is a God-sent gift. Treats extremely vulnerable children that sometimes come here with multiple conditions, not only the they're admitted at CoRSU. And in that case, we also need to coordinate with other hospitals for medical checkups, on and so forth. And so far we have been trying very, very hard to get an ambulance in the past years, but unfortunately we did not succeed. What does it mean? It means that we need to hire ambulances, which comes at a cost, and most importantly, or seriously, it can come with a delay, and you don't want to delay a referral. So we do expect this ambulance to have an immediate impact on the treatment and the care of our patients, especially the most vulnerable ones. So we are incredibly grateful for this donation, which is very relevant and useful.
Asked on how prepared they are at CoRSU Hospital in such times of an Ebola outbreak in the country, David said they have established a committee to take charge of the preparedness.
We do follow the Ministry of Health guidelines, literally. We do have a committee that is in charge of overseeing these aspects within the hospital, and it would be a bit arrogant of us to say that we are prepared, because when we face a situation like this, it's very difficult to say that you're 100% prepared. But we are on top of it, and we are working around the clock to make sure that screening of patients and staff are being done as required.
Abdul Ghani of Khan Investments was key to the donation of the ambulance following his recent experience at the hospital.
Why we have given this ambulance to this center, CoRSU, Uganda, my son has been born back 6 months back, and he was club-footed. Somebody told me there is a center, CoRSU, you can donate, you can take the child there. We brought him here, and he has been recovered. That is the main reason we have decided. I told my friends, let's go donate here. So that is the main reason we have donated here. It will work for many children.
Zeshan Al-Shad, the OPGF chairperson Africa region, said today's donation is the 19th they have done and intend to donate more ambulances in the near future.
The organization, our OPGF, we've taken this initiative like 3 years before to have these ambulances network of 26 ambulances across East Africa, including Uganda, Kenya, and Tanzania as well. And this is 19th one we have done. Why we did this? Because in the remote areas, That's the most important thing when you have any patient or any emergency, to transport people from rural to urban area. That's the main thing, and you must have those equipments with the ambulance, that people in a situation, in emergency, they can have oxygen, they can have those first aid kits and all. So we realize that in this area, we must need these ambulances to help people in the health sector.
Kenneth Nwagaba, Bunyoro TV News at 4.